Hi, this is Dr. Chris Banning at White House Chiropractic and Nutrition. Today's podcast, I want to introduce you to somebody that was pretty fascinating to me, actually. His name is Tim.
Hi, everyone. Good morning.
Yes.
Good afternoon.
So just to review, how did we meet?
Well, I guess you could say we met organically. My wife and daughter and I are staying at our in-laws just down the block over there in White House, and we needed a great chiropractor, and that's exactly what we found in Dr. B. So we sort of met by necessity, and then sort of gradually started having a side conversation about nutrition, health, supplements, naturopathy.
Right. Yes.
Yeah.
So Tim came in as a patient. Unbeknownst to me, I didn't know he would know all this information about nutrition, and so during the day one, I discovered Tim's passion was nutrition, and so I was like, oh wow. So we got to talking, and I could not believe the knowledge that he had obtained, and so I was amazed at that, number one. And so how did you become so knowledgeable, Tim?
It's a great question. So first and foremost, I have no formal background in nutrition or naturopathy or herbalism or anything like this. It's sort of just a passion of mine, and I guess you can say it started when I was studying abroad in Florence, Italy in 2000. I was part of the New York University study abroad program, and unfortunately for me, I came down with two forms of parasites, the micro, sort of the amoebic ones, I guess you could say.
Amoebic dysentery, is that what they call it?
Dysentery was one of them, and then there was another one which escapes my mind, but certainly they were both microscopic.
So at this time, did you know very much about nutrition?
You know, I had always tried to live like a healthy lifestyle, but certainly it was the beginning of my journey. I really didn't know a fraction of what I know now.
I got you.
Yeah.
So do you know how you contracted it?
I believe it was some tainted soup. There's a Tuscan soup that they're famous for called ribollita, and has, amongst other things in it, kale and beans and pork.
Oh, that sounds good.
It was the pork that got me, I think.
Was it? Okay. So, so how did you discover this?
So, I wasn't feeling well. I was having digestive issues of all kinds. Actually went to see a doctor there while I was studying abroad, and unfortunately he didn't really, nail it. He couldn't figure out what was wrong with me. Right. And then when I came back, my mom met me at the airport. She's like, oh, you can tell I'm skinny and slim right now. I had lost about 15 pounds, so I was probably about the 145 marker at the time. She's like, oh my God, what's wrong with you? I'm like, well, my stomach's bothering me. I feel really weak and tired and just overall yucky. So we started going to doctors, GIs, gastroenterologists. Went to see about maybe 6 in all. None of them could figure out what was wrong with me. They're like, oh, it's probably something you digested. It will pass on its own, blah, blah, blah. Did traditional stool tests, nothing came up. Finally, thankfully for me, somebody recommended, actually it was my dentist, my orthodontist at the time, recommended that I see somebody named Dr. Cahill, who is, I'm not sure if he's still in practice, but he was a expert in parasitology, immunology, I guess tropical medicine specialist, and he actually, within a day's time, he said, well, you have this amoeba and another one, and here's what you're going to take, this, and this, and sure enough, that was the beginning of my road to recovery, I guess you could say.
So did he give you medications?
He gave me medications, and although it's not my preference ever to take these things, I really had no choice. It was, basically, at that point I had, I think, parasites for about 6 months. So I really had to do an allopathic intervention. So, but then I promised myself from that point on I would find nutritional ways and homeopathic ways and other ways just to kind of build my body back up to its where it needed to be.
So that was your personal journey.
That's my personal journey in a nutshell.
So often, because I could tell you were passionate about nutrition, and I'm like, this guy knows about as much as I do about nutrition. We have different understandings at some points, but I understand where you've been studying, and you kind of understood where I was studying and so forth. And so many times, we become passionate about something that helped us, that healed us, and so that's pretty cool there. And so you've had some other health challenges as well with family members.
So yes, so my wife was diagnosed with Hashimoto's disease. She always had thyroid issues, and tried to treat it through various ways, but she went to an endocrinologist, I get at this point maybe a year and a half ago, hard to say exactly, but the endocrinologist was sort of very stuck up, I guess is a very casual way of putting it, and very dismissive. She's like, I don't think there's really anything wrong with you. I mean, I'm pretty sure that all your test results are going to come back normal. You won't hear from me unless there's something irregular or abnormal. Sure enough, I think it was a few days later, she got a call from the endocrinologist saying, yeah, you have a confirmed diagnosis of Hashimoto's syndrome. And she's like, okay. So my wife asked, what do you suggest? What are the treatment options? Well, you know, it's a very mild case. We don't really suggest any sort of medical allopathic intervention at this point. She's like,
So, okay.
yeah,
So wait until it's bad enough.
bingo.
That's just how it works. Wait
It
until
is.
it's bad enough. So, okay. So long story short, your wife is pretty much into nutrition as well.
Yes,
Did you teach her, or is she pretty? I mean, how did she get a good understanding?
It's a good question. Combination. So she had sort of a basic understanding,
Uh-huh.
but I, you know, as I did for myself, as I did for my mom and also my daughter, which we can get into in a little bit, I sort of did a deep dive,
Yeah.
personal research into the individual issues and
Right.
natural ways to, we don't want to say treat, but to sort of combat or negate the problems that we have. So I gave her a lot of input. She also found something called the AIP diet, the autoimmune protocol. Yes.
Yeah. Is it like the Waltz Protocol, or is it a little different, or just?
I'm not familiar with the Waltz Protocol, but
Okay.
it's sort of like a modified paleo diet.
Okay.
So you're basically removing all the trigger or allergic trigger
Mhm.
foods. So that's all the fun foods, as we like to call it. So dairy's a no-go, gluten, nightshades, can't do any of those. Obviously legumes, things like that are problematic.
Mm-hmm.
So she eats a very clean diet, and probably a few months into that, she more or less put herself into remission doing that.
Right. So, and then your mom, you also help your mom out.
I did. Unfortunately, my mom smoked pretty aggressively for about 4 decades. And so, not to give too much information, but it was a summer, I remember, it was a summer, there was a really bad virus going around, put everybody on their backs, including my mom. So she really couldn't do much of anything for about a period of 2 to 3 weeks. And in that period of time, she inadvertently ended up quitting smoking. Because she couldn't get up, she couldn't really eat anything, let alone smoke a cigarette. So it was sort of what we thought was a blessing in disguise.
Right.
But then about maybe a year later, she was diagnosed with stage 3B lung cancer, adenocarcinoma, as a direct result of smoking.
Right.
But long story short, we found he's technically not an integrative oncologist, but he was very much somebody who was into alternative medicine or complementary medicine.
Mhm.
He worked with a integrative physician, and he and I really hit it off and
Okay.
exchange information, and with his help and my input, we managed to keep her alive and, apart from the cancer, really healthy for a period of 4 years.
Good quality of life.
Great quality. Nobody
You know-
knew she was sick. She didn't lose her hair. She was walking around doing everything that she needed to
See, I
do.
know that a lot with cancer patients, the
Yeah.
issue with the treatment is the quality of life.
Yeah,
They have no energy. So if you can give them 4 years quality,
that's
a
it.
pretty big deal. Plus family members, grandchildren and so forth. So let's talk about something. This is an obvious example, but it's really important for people to stop doing what's causing their deficiency or their
Yeah.
illness, right?
100%.
And so in this case, I think most people would understand that smoking cigarettes
Right.
for 40 years would probably put a big stress on your body. So if you could remove that stressor,
Right.
of course everybody's like, well, you're going to gain weight or this, that, and the other.
Yes and no, though, because
Yeah.
through nutrition and the
Right.
proper supplementation, the proper lifestyle changes, you can not only not gain weight, but in fact lose weight and
Right.
gain muscle and health
Right.
along the way.
So that concept is real obvious to a lot of people, but something might not be as obvious. But when we're dealing with nutrition, we're a lot of times we've got people that are eating foods that are just toxic.
Oh, big
They're not
time.
good for them.
Yeah.
Like Monster Energy drinks or things that contain high fructose corn syrup. Now,
Right.
this is the crazy thing. You can get a can of almonds, and they can have high fructose corn syrup in them,
Oh,
cornstarch.
That's
and
true.
people be eating the almonds,
Right.
and their blood sugar is going sky high, and they don't
Yeah.
even know about it. And so, it's really important to address some of your toxicities or some of your things that you're eating and get rid of them.
Mm-hmm.
And then the other thing is if you have a deficiency,
Mm-hmm.
complete it.
That's right.
And so that's what we do with nutrition. So let me ask you this: is getting well an event, or is it a process?
Not only is it a process from my perspective, but it's an ongoing process because you're always trying to find out what's missing. You're almost like a detective of sorts.
Right. So it's not an event?
Well, I mean, it can be an event.
I'm just kidding with you, because a lot of people think if I take this vitamin, I'm going to get better instantaneously, and they don't understand.
The one pill solution. Yeah.
Right. I know I'm not very good at fixing cars, or fixing houses, or fixing roofs, or leaky pipes. But when you can fix your family's illnesses and problems, not necessarily fix them, but manage them and support them with nutrition and show them a better way.
Right.
That's everything.
I couldn't agree more, and it comes down to, habits. Everybody's got habits. It's really up to you whether or not those habits are bad or good. Right. So it's a lot of retraining your brain, retraining your body to lead a healthy lifestyle and to make the changes that you need to make in order to gain true health.
Right.
Yeah.
Yeah, so it takes self-examination. So, so if we were to look at a car and the oil light came on, what does that mean?
Presumably it means you have to change your oil.
Is that what it means? Or maybe it's low or something?
Right.
Now, so what if I put a piece of tape over that oil light and I didn't see it anymore?
That's right.
Would that fix it?
Sure wouldn't.
Okay.
If it did, that would be amazing.
Yeah, it would be. I'd be buying the tape like crazy. So that's our allopathic model. Just like the endocrinologist told your wife that he came up with, you've got Hashimoto's disease.
Right.
Wait until it's bad enough. Wait for that light to come on, and then what? We'll give you some medication?
Exactly.
Cover up the problem?
Exactly.
Okay.
And you can take it a step further, Dr. B. I would say that, and this, of course, is a generalization, so not all allopaths feel this way, but by and large they've been trained, or I should say conditioned, into not really focusing on optimal wellness. Right. They really look for quote-unquote problems or things that are out of the norm for them, but they don't focus on the patient's health or optimizing that health.
Right.
And this is really where naturopathy and homeopathy and nutrition and all these other things really kind of take a different path. Absolutely. From the standard treatment protocols.
Absolutely, totally different philosophies.
Right.
So in today's world right now, we're looking at symptoms, and we're going through this COVID virus, and the people that are making it the best are the people that have good blood pressure, are not obese,
right,
are not taking blood pressure medication or cholesterol medication, and those are the types of people, the diabetics, that really need to look out for lowered immune function.
Oh, absolutely.
Yeah, so how important is nutrition going into what we call the flu season? Is that very important?
I would say then and always. So I mean, it's cliche, but you are what you eat. So if you're if you're taking in, for lack of a better description, garbage into your body, and or not feeding your body with the things that it needs to achieve optimal wellness, you're doing a huge disservice to yourself, and you're opening yourself or exposing yourself to sickness, not only just infections, but just general conditions and syndromes, and also cancer. Right. Degenerative diseases.
Right. So it's good to be proactive, to examine yourself, and to continuously learn new skills. Exactly. At least that's what I've gathered from what, I'm 58 years old and I'm still learning like crazy about my own health. The whole thing is to be proactive instead of sitting there being passive, waiting for a symptom to come around, or waiting for hypothyroidism to manifest itself. Okay, now let's take care of it, instead of, addressing it through nutrition, through exercise, through healthy sleep, through handling stress, things like that. So unfortunately, though, the vast majority of people, probably 90+%,
I'd say so,
typically will wait for a crisis to happen.
Right.
They go to the hospital, and they're forced to do things they do not want to do.
Right. And
kind of like you. And they'll face these health challenges, and guess what? You know what? I don't want chemo, I don't want to do this, I don't want to do that. And then occasionally you'll find somebody like you that just did a ton of studying and reading, and was able to make a big impact not only on your life, but on your wife's life, on your mother's life, and of course on your daughter's life. And so You didn't fix them.
Right.
You got their body healthy. You got rid of the toxins. Your body was able to function. The body can heal itself if you give it what it needs.
That's exactly what it is, and not only that, but the human body has a huge resilience
Mm-hmm.
and ability to sort of thwart diseases and conditions just by optimizing itself. So,
Exactly.
but it's just, not to make another car analogy, but
Yes.
you wouldn't put sugar in your gas tank. You when you're taking care of your car, you use all the good parts. You use the people who know how to work on these parts correctly. It's the same with the body.
Mm-hmm.
I guess the biggest differentiating factor is that the human body, unlike cars, can be a little bit more complex because we're not all the same. We all have different needs, different
Exactly.
health conditions or challenges or
Very
things like
good.
this. So.
I don't know what else to say. Any questions, Aaron?
Covered it all.
No questions? We covered it all? Wow.
Everything I wanted to know.
Okay. Well, very good. So thanks, Tim, for coming on. I appreciate your story
Thanks
and
for
your
having
journey
me.
to health. It's been great meeting you. This is Dr. Chris Manning at White House Chiropractic. Thanks for listening. If you have any questions, you're more than welcome to call the office at 615-672-7878 or look us up on our website, whitehousechiropractic.com.